Hello and welcome to Lyra Nara. And in today's video we're going to talk about a set of conditions that affects over 6 million people. Some people even go as far as calling it an epidemic. And that is gastric and peptic ulcers. And we're gonna talk about the causes, the symptoms, and all the therapy modalities that are available. So, without further ado, let's dive right in and learn more about this condition and how to treat it, of course. So let's start by defining what peptic ulcers are. Your stomach is very acidic. It has a pH of between 1 and 3. And there is a mucosa that lines the stomach and to a lesser degree the duodenum and protects it from the stomach's acid. When this protective layer breaks down, stomach acid can attack the stomach or the duodenum or the esophagus walls and cause an ulcer, which is a necrosis. And the ulcers are a painful open sore that may also bleed. And ulcers are not to be confused with a gastritis, which is an inflammation of the stomach lining. Ulcers can be seen as a type of a cancer, but with a cell loss in the conflict active phase and cell replenishing in a healing phase. And if not treated, ulcers can lead to serious complications such as hemorrhages, perforations, fibrous scarring, and constriction. And some of this can be life-threatening. Peptic ulcers usually manifest themselves through the following symptoms: nausea, vomiting, bloating, loss of appetite, abdominal pain and cramps, weight gain or weight loss, dark or tarry stool, blood in your vomit, heartburn, and the symptoms worsen when the stomach is empty. You also may experience flares of the symptoms at night, and the symptoms might disappear and return for a few days or weeks. But to make sure that you're really suffering from a peptic ulcer, you need to go and get the diagnosis. And the most precise way of determining whether you're suffering from an ulcer or there is any other problem that causes your pain in the abdominal area or the other symptoms that we've just discussed, normally you will be recommended to have an endoscopy where they insert, as you can see in the upper right image, a tube through your mouth with a camera and a light, and they look for the ulcer, and that is usually followed up by biopsy, where they take a small sample of the ulcer and analyze it afterwards. You could also do less invasive diagnosis, for example, through stool testing, where they look for the Helicobacter pylori, which we'll discuss in more detail later on. You can also perform a blood analysis, where they look for the A, G, and M values, or a breath test where they look for the CO2 concentration in your breath, and we're gonna see why they do this as well. So now we've seen the symptoms that we have to pay attention to. We've seen what the ways in which you can precisely diagnose whether you have an ulcer or not. Next, let's look at what causes an ulcer. And the number one cause, also according to conventional medicine, is stress. More specifically, psycho-emotional shock that is related to a male territorial or a female identity conflict. And conventional medicine also considers other causes. For example, the amount of acid in your stomach being increased, and that is called the high acid theory, and the amount of mucus that lines your stomach walls being decreased. Another, now the most popular actually, theory on the causes of ulcers nowadays is Helicobacter pylori, which is a gram-negative bacteria, so double-walled bacteria, which burrows itself into your stomach wall and damages the mucus layer there. And this bacteria may enter your body through contaminated food, water, or close contact with an infected person. The interesting thing about this Helicobacter pylori is that over 60% of the world population is infected with this bacteria, but not all the 60% of the world population has ulcers, so this bacteria does not lead automatically to ulcers. Another factor that causes ulcers, and there is no discussion about that, is NSAIDs. So non-steroidal anti-inflammatory drugs like aspirin, ibuprofen, Advil, Aleve and the likes. And these drugs are known to reduce your capability to protect yourself from the effects of stomach acid. What they do is they block the enzyme called COX-1, which helps prevent ulcers by enhancing blood flow to the stomach and increasing the production of mucus. And they affect negatively all three defense mechanisms of your stomach: the mucus production, the bicarbonate production, and the blood circulation to the stomach for cell renewal and repair. What may also lead to ulcers is the mineral and vitamin deficiencies, especially B1, B2, B6, B12, vitamin C and folic acid deficiencies. Also a condition called hypercalcemia. Also excess coffee, alcohol and cigarettes consumption, overeating, consuming refined foods, and many more, but those are the most important ones. Important to note, however, is that the Medical Journal of Australia looked at all known causes and contributing factors to peptic ulcers, and they concluded that none of the medical school mentioned causes of ulcer explain satisfactorily the epidemic of gastrointestinal ulcers. They said, quote, in their conclusions, "In summary, peptic ulcer will likely disappear from the list of important gastrointestinal disorders before we fully determine its cause." End quote. Next, I would like to focus more on some of the main causes of ulcers, starting with the most important one, and that is stress. And that was recognized as the main cause of ulcers even by conventional medicine until the Helicobacter pylori theory became the more popular one. And for your better understanding, we first need to understand our whole makeup, the whole structure of our esophagus, stomach and small intestine. And for that I've put here the picture up. And the stomach is of course located in the upper part of your abdomen and connects to the esophagus with the intestinal tract. And the top of the stomach lies against your diaphragm. The stomach contains glands that secrete gastric acids and digestive enzymes to aid in the digestion of food. The duodenum, which is the first section of your small intestine, as you can see also in the picture, absorbs the nutrients from the food that passes through it. And for the breakdown of food, the duodenum receives bile from your liver, and through the pylorus it receives also pancreatic juices that are produced, as the name already suggests, in your pancreas. The lower esophageal sphincter at the top of the stomach prevents the backflow of stomach content, and the stomach, except the small curvature, and the duodenum, except the duodenal bulb, consists of intestinal cylinder epithelium that originates from the endoderm and is therefore controlled from the brainstem. And in the brainstem, as you can see also from the pictures on the right, the control centers of the stomach and duodenum are positioned within the ring form of the brain relays that controls the organs of the alimentary canal. The control center of the stomach is located between the esophagus and the liver relays, and the control center of the duodenum between the brain relays of the pancreas and small intestine. And when talking about stomach and or duodenum cancer manifested with cell growth, which is a carcinoma, we look at the relays that are located in the brainstem. These relays control the biological conflict of an indigestible morsel. And for animals, an indigestible morsel is a real piece of food, whereas for humans, the conflict relates also to any situation or circumstances that you feel you are unable to digest or you cannot stomach them. And when we look at ulcers in the peptic region of the stomach, the duodenum or the pylorus, we must consider the epithelial mucosa of the stomach in the small curvature, the pylorus and the duodenal bulb. And these are all controlled from the right temporal lobe, which is part of the postsensory cortex. The control center is positioned exactly across from the brain relay of the rectum lining. And the stomach, the small curvature of it more precisely, the pylorus, the duodenal bulb, the bile ducts and the gallbladder, as well as the pancreatic ducts, share the same brain relay and are therefore they share the same biological underlying conflict. Which one of these organs will be affected by the psycho-emotional stress and the specific conflict is random. A severe conflict can affect all organs at once. And the psycho-emotional conflict that is linked to the stomach ulcers located in the small curvature, a pylorus or the duodenal bulb is a male territorial anger conflict, so a fight for the territory, or a female identity conflict, depending on a person's gender, laterality, and hormonal status. In line with the evolutionary reasoning, territorial conflicts, sexual conflicts, and separation conflicts are the primary conflict themes associated with organs of ectodermal origin that are controlled from the sensory, premotor sensory, or post-sensory cortex. A territorial anger relates to anger in the environment and places which one considers as his or her domain, literally or figuratively. Typical territorial anger conflicts are disputes at home, fights at the workplace, anger at school, in the kindergarten, at the playground, in a nursing home for seniors, or in a hospital. Also in the extended territory, such as in your village, your town, or your country where you live in. Also battles over land or property, annoying noise in the house or neighborhood that persist, a fight over a parking place, or over a toy for a child, or other examples of what can provoke territorial anger conflict. And the biological special program of the stomach and duodenum ulcers follow the Goulet conflict active phase. Ulceration in the lining of the stomach, pylorus and or the duodenal bulb proportional to the degree and the duration of the conflict activity. The biological purpose of the cell loss is to widen actually the passageway of the digestive tract so that the nutrients can be utilized more efficiently. And this in turn provides the individual with more energy to resolve the conflict. Symptoms are indigestion and mild to severe pain, depending on the intensity of this territorial anger conflict. And food enhances the pain because of the increased secretion of stomach acid produced in the stomach. Painful ulcers develop when a territorial anger conflict persists for a longer period of time, called a hanging conflict. And the stomach ulcers, the pyloric ulcers, and the duodenal ulcers often occur together. If the ulceration reaches deep into the tissue, the epithelial layer becomes thin and might even rupture, and a perforation of the stomach is a life-threatening situation. According to conventional medicine, stomach ulcers are supposedly caused by gastric acid. We've discussed this, the high acid theory. And this assertion, however, is inaccurate because gastric acid is produced and stored in the bulk of the stomach, which very rarely or never develops ulcer. Ulcers develop mostly in the lining of the stomach or the pylorus. The theory that stomach ulcers are related to the bacterium Helicobacter pylori, a claim for which Barry Marshall and Robin Warren received the Nobel Prize in Physiology and Medicine in 2005, is also inconclusive because microbes are only active in the healing phase. Hence, the Helicobacter pylori does not, as assumed, cause stomach ulcers, but helps to restore the stomach and pylorus lining after a territorial anger conflict has been resolved. Also, do not confuse ulcers with gastric reflux or heartburns that are nowadays called gastroesophageal reflux diseases, or Gerd for short. It's originally linked to the lower esophageal sphincter located at the top of the stomach and responsible for preventing the backflow of stomach acids into the esophagus. And during conflict activity of territorial anger as well as throughout the healing crisis, they can never cause an esophageal cancer as claimed by conventional medicine. Stomach cells also secrete a so-called intrinsic factor that helps the body to absorb vitamin B12 in the small intestine. and vitamin B12 is needed for the production of red blood cells. The loss of stomach cells during conflict activity of a territorial anger conflict can cause pernicious anemia, therefore. And with that we come to the ulcer healing phase, so to the conflict resolution. During the first part of the healing phase, the tissue loss is replenished through cell proliferation. And in conventional medicine, this might be diagnosed as a stomach cancer or duodenal cancer. The new cells cannot be regarded as cancer cells since the cell increase is in reality a replenishing process. Healing symptoms are swelling due to the edema, so fluid accumulation, and stomach pain, which could last throughout the entire healing phase. The pain is not of a sensory nature but a pressure pain. With an inflammation, the condition is called gastritis. Conventional medicine also claims that stomach flu is an infection caused by a variety of viruses, including the infamous Norwalk virus. Norwalk virus is a common cause of vomiting during wintertime and has often been referred to as stomach flu or winter vomiting disease, therefore. Norwalk virus infections have been linked to outbreaks of vomiting in institutions such as child care centers and long-term care facilities, as well as on cruise ships, camps, schools, and households. I would also like to further underline the importance of stress when it comes to peptic ulcers by showing you how our system works, because stress affects the adrenals and therefore stomach acid production. And digestion doesn't start in your stomach, it starts in your brain with smell and visual inputs which trigger, for example, saliva secretion. The autonomous nervous systems, which consist of the sympathetic and the parasympathetic branch, they control the stomach activity, as you can see also from the graph on the right. And when the sympathetic is dominant, which is the fight or flight condition, digestion becomes slower, blood supply to the stomach is decreased, the liver breaks down glycogen into glucose, blood pressure increases, your blood thickens, and your energy increases, so you can fight or flight. When the parasympathetic, on the other hand, is dominant, which is also called the rest, digest, and repair state, you have good gastric motility, digestion, etc. So you have only good digestion when you are in the parasympathetic dominant range, when you are calm. We therefore have to look first at the central nervous system and the autonomous nervous system with any digestive problem, because these are controlled by the epigenetic factors, and the most important in this group is, of course, as we've discussed, the psycho-emotional conflicts. I would also like to shine a light on nowadays the most popular theory for the causes of ulcers according to conventional medicine, and that is Helicobacter pylori. What does this bacteria do? Well, it creates urease in your stomach. And when the urea that we have naturally in our stomach gets attacked by urease, it breaks down into CO2 and ammonia. And that is why they recommend that you do this breath test that we discussed in the diagnostic section, so they can check for increased CO2. And our stomach, as you know already, needs a pH that is very acidic, of between 1 and 3. As pH increases, so it becomes more alkaline, our stomach has decreased HCl production, decreased protein digestive enzyme production, and an increased dysbiosis, which means that you have lots of bad bacteria in your stomach. Helicobacter pylori also increases your thyroid antibodies and can therefore lead also to thyroid problems. The funny thing about this Helicobacter pylori, though, is that 70% of people that are infected with this type of bacteria are asymptomatic, so they never develop ulcers and they don't have any symptoms. Also, the risk of infected people developing peptic ulcers in their lifetime is estimated at only 10 to 15%. And the risk of developing gastric cancer because of this bacteria is at less than 3%. Let's talk also a little bit about the allopathic treatments that your doctor recommends you. So, after performing, of course, the diagnosis, he will usually prescribe you antibiotics to combat the Helicobacter pylori infection. And we've seen already that this Helicobacter pylori infection theory as the cause of ulcers is quite problematic because 60% of the global population, so about 3.5 billion people, are infected by this bacteria, but only about 6 million have ulcers. But nonetheless, he will prescribe you antibiotics to fight the pylori infection. He also will tell you to stop taking NSAIDs, which makes sense, of course, because NSAIDs, as we have seen, are proven to create ulcers and many other problems if overused. For gastric ulcers, he will recommend proton pump inhibitors, or PPIs for short, to decrease the acid production in the stomach. For duodenal ulcers, he might recommend H2 blockers, which are histamine type 2 receptor antagonists, also to reduce the amount of acid that is secreted. With the problem with these antacids, if you believe in a Helicobacter pylori infection theory, is of course that it makes no sense because, as we have seen, this type of bacteria already decreases the acidity in your stomach in order to create a better environment for it to thrive. So why reduce the amount of acid even further? You might also get medications to coat and protect the lining of the stomach and duodenum, such as sucralfate, misoprostol, bismuth subsalicylate, better known as Pepto-Bismol. And if the ulcer does not heal or comes back, you will then be recommended surgery. Surgery may also be needed for bleeding ulcers or perforations of your stomach to repair the damage. Surgery is also recommended for ulcers that block your stomach exit. And the following types of surgeries exist. Vagotomy, where they cut the nerve that tells your stomach to produce acid. Antrectomy, which removes part of the stomach that tells the stomach to release acid. And pyloroplasty, if the stomach exit is blocked, they widen the pylorus. The problem with all of these allopathic treatments are also their many negative side effects. For example, antibiotics, they kill also the beneficial bacteria in your gut and they upset the balance of your intestinal terrain. James Collins, a PhD at the Wyss Institute of Howard University, had the following to say about antibiotics. Quote, clinical levels of antibiotics can cause oxidative stress that can lead to damage to the DNA, the proteins, and the lipids in human cells. End quote. Antacids are problematic not only because they don't go well together with the Helicobacter pylori infection theory, but also because they are known to bring only short-term relief. PPIs, so these proton pump inhibitors, they are known to actually increase the risk of gastric cancer, according to the British Journal of Cancer. They increase adenocarcinomas, and they also lead to hypergastrionemia. They also loosen the lower esophageal sphincter, and that causes acid to flow up your esophagus and attack it, and that is also known as acid reflux. So now that we know that all of these allopathic treatments come with many side effects, let's see if we have better options out there. And the good news is that yes, we have a lot of holistic treatment options. Apart from, of course, that is what we have discussed already, and that is dealing with your stress situation, with your psycho-emotional shocks. That is the number one. But you can also supplement and use certain types of food to help your ulcer heal faster or not develop it in the first place, of course. Recommended are, for example, apple cider vinegar, raw honey, aloe vera juice, baking soda, but only short term, please, otherwise it will have other unwanted effects. Coconut in water form or milk or oil form is great. Green tea has a lot of antioxidants, is great. Ginger or ginger tea, yogurt and kefir for the great probiotics in it. Pineapple juice, turmeric, which is known to be a great anti-inflammatory. Almond milk for the pH in your stomach. Mastic gum, raw potato juice, glutamine. Also great is intermittent fasting or water fasting, or the Johanna Budwig diet. Garlic is great. Some vegetables such as onions, kale, bell peppers, tomatoes, spinach, beans, broccoli and cabbage are really great. When it comes to cabbage, you can also drink cabbage juice. If you don't like the taste, mix it with a little bit of carrot juice for a better taste. Cabbage is really great. Also some fruits that are recommended are apples, cranberries, blueberries and cherries. Recommended is also that you consume only lean meat, oatmeal, olive oil, red wine, not in great quantities of course. We've talked about alcohol consumption, but a little bit actually helps. Horseradish, flaxseed oil, zinc carnosine and bone broth is really good for your stomach. Also important, because we look at it holistically of course, is that you get a good restful sleep. You do regular exercising. Even walking is enough. 30 minutes or 1 hour, maximum 2 hours per day is enough. But please take care also of your regular exercise. Of course, no coffee, no alcohol and no cigarettes. Maximum 2 to 3 small meals during the day. Eat in general smaller portions. Of course, get off your harmful medications, especially the NSAIDs and painkillers, etc. Those are really harmful, as we've discussed. Also, no sugars. You can use Lakanto instead, for example. No fried foods, only or preferably cooked and steamed vegetables. I've recommended already some to you here in this list. Also, careful with your fiber intake. And of course, no carbonated and or caffeinated soft drinks. All these energy drinks are definitely not helping. There are also some great natural remedies and homeopathic remedies that I can recommend. When it comes to herbal remedies, different herbs have very beneficial effects for your stomach and for specifically in this case stomach and duodenal ulcers. We have bundled and compounded the most efficient of these herbs and combined them with pharmaceutical grade ultra pure DMSO in the following Herbeso products. We have the Herbeso Ulcer Gone, the Herbeso Ulcer Prevention and the Herbeso Digestion Well. All of those three herbal products are highly recommended. They work great. Links in the description box below for you. And when it comes to homeopathic remedies, we can tell you that the following homeopathic remedies are recommended. Argentum nitricum for the stomach ulcers with radiating pains. Argentum nitricum rates among the best medicines for stomach ulcers, and this medicine is also well indicated for sharp ulcerative pain. Nux vomica, it's best suitable for stomach ulcers where eating worsens the pain, and the stomach region is also sensitive to touch in such cases. Next, Kali bichromicum is another of the top grade medicines for stomach ulcers when it comes to homeopathic remedies. We have seen amazing recoveries in gastric ulcer cases with Kali bichromicum. It is indicated in round ulcers with a feeling of heaviness in the stomach soon after eating, and also when the food seems to sit in the stomach like a load and your appetite is low. Next on the list of natural remedies is Lycopodium, suitable for ulcers with a bloated abdomen. It has proven itself as the most useful medicines for stomach ulcers where the main symptoms are burning, constrictive pains that are attended with marked flatulence and a fullness or bloating of the abdomen. Carbovec is another of the prominently indicated medicines for stomach ulcers. It is most helpful when a burning pain in the stomach is accompanied by sour belching or a heartburn sensation. And the pain may also extend from the stomach to the back. The epigastric area may also be sensitive and tender to the touch. Hydrastis canadensis for stomach ulcers with vomiting after eating. And phosphorus is also rated among the most reliable medicines for stomach ulcers where having a cold drink relieves the pain. And the burning in the stomach after eating is complained of. Along with this, sour, bitter belching may also be experienced in such cases. When it comes to ulcers in your duodenum, the following homeopathic remedies might help you. Uranium nitricum. It's the ideal remedy for gastric and duodenal ulcers that are characterized by boring pain in the pyloric region, a bloated abdomen, and a ravenous appetite followed by flatulence. Kali bichromicum is best suited for round ulcers occurring in the stomach that lead to vomiting of bright yellow water and a load in the stomach immediately after eating, giving the patient a feeling that digestion has come to a standstill. Crotalus horridus is helpful in cases of ulceration in the stomach due to chronic alcoholism, and patients who are unable to retain anything, exhibit violent vomiting, or vomit blood, they all benefit from this medicine. Graphite is good for treating duodenal ulcers marked by a burning in the stomach and a feeling of hunger. Merksol is among the top listed medicines for ulcers also. It is recommended specifically for ulcerative colitis. And Kali, Bichrome, and Argentum nitricum are the most appropriate medicines for peptic ulcer. So let's sum it all up and see what we've learned in today's video. As we've seen, all of the theories of conventional medicine about the causes of ulcers are and can be debated, but where allopathic and alternative medicine both agree is that stress is the #1 cause, also excessive use of NSAIDs, alcohol, cigarettes and coffee, overeating, bad nutrition, lack of exercise, lack of sleep, they are all factors that cause and contribute to ulcers. And the best way to address peptic ulcers is holistic. So you must address your mind, your body, and your spirit. First, you must take care of your stressors, your psycho-emotional conflicts especially. Also, sleep well, eat well, exercise regularly, eat healthy food. We've discussed it, for example, no fried food, etc. Take the right probiotics and the right natural remedies and supplements to help your system heal itself. As I've mentioned in the remedy list, there are some great natural remedies out there. Some of them are linked in the description box below for you. And surgeries should be taken into consideration only as a last resort, of course. And with all that being said, if you have further questions about this topic, please do not hesitate to contact us, shop@lyranara.com. I'm also going to post the complete contact information, including our toll-free phone numbers, in the description box below for you. If you've enjoyed this presentation, please also support our work by liking, sharing, and subscribing. It helps us out a lot. And with all that being said, I hope that you remain healthy. Until next time.